Good day everyone, I'm Dr. Gulnar Maharramova, a specialist endodontist based in Baku, Azerbaijan. In today's video, I will be showing a case of using Woodpecker Endomotor Motopex and how it helps me in my daily practice. I would like to begin with sharing some outstanding features of this endomotor. Firstly, it is lightweight, and this enables me to do several endodontic treatments and retreatments in a day without getting tired. Secondly, this endomotor is extremely silent, and this helps in minimizing fear in worried patients. You will now observe the treatment of tooth number 34 with irreversible pulpitis. The local anesthesia, isolation, and removal of caries tissues were performed before we started the actual treatment. As the name goes, Motopex combines the function of an endomotor and an apex locator in one device. All you have to do is to place the clip and keep electronic apex locator mode on, so you can control the length of shaping. The next step was to use Motopex in apex locator mode and then continue with the shaping. Motopex provides us with the unique choice of rotational clockwise or counterclockwise and reciprocational motions. For effective shaping, I highly recommend to start with the calibration of an endomotor. The range of speed varies from 100 to 1200 RPMs, torque from 0.4 to 5 Newton centimeters, and forward-reverse angles from 20 to 400 degrees. Another useful mode of this endomotor is ATR, Adaptive Torque Reverse Reciprocation Motion, to manage ledges and curved canals. Within minutes, I was able to complete the shaping and the final irrigation of the root canal. Laser energy was used to activate the solution of sodium hypochlorite. I obturated the canal by means of injection of worm gutta percha.